Treatment of the gummy smile, part 5. What we want to go into now really is a philosophical part of our treatment philosophy, and what that has to do with treatment is that our diagnosis really is multifaceted in looking at the hard tissues and soft tissues, and this produces what I call the cumulative effect of this systematic evaluation, which we have described in earlier webcasts, and translation of that evaluation into treatment. Our young lady here, age 11 and a half, has a very gummy smile, and it's not just, fixing the smile that we're talking about here, but we're talking about an enhancement of her quality of life. That we feel our role as orthodontists is not just to fix a bite or just to fix a smile, but to provide treatment that makes this child's life better. Let's start off with looking at vertical relationships. You note that the vertical thirds are placed here, and we note that the lower face is slightly shorter than the other two thirds. When we look at the lower third, the philtrum or upper lip height in comparison to the total lower third is somewhat short. When we look at profile, she has a slightly deficient mandible, and her maxillary incisors are what we call compensated or very upright. And if you remember from our differential diagnosis, upright maxillary incisors contributes to a gummy smile. We'll show you how that works. Let's go through our systematic evaluation of the tooth to lip relationship. Philtrum height is 15, commissure height is 22. She has a reverse resting lip line. She has incisor at rest of 8 millimeters. These are all things that we're going to measure as part of our clinical exam. The incisor height is also 8 millimeters, and gingival display is 4 millimeters. We deem that her buccal corridors are slightly excessive. In other words, she has dark corners in the smile, and the smile arc is consonant, and that's important because we don't want to move the incisors up to reduce gumminess of the smile at the expense of flattening her smile. Well, let's start off in the diagnosis. We're not going to run through all the possibilities, but just to show you how that checkoff list that we used in Gummy Smile Part 1, the first thing in gummy smiles that we might suspect is vertical maxillary excess, and the clinical characteristics are excessive incisor display at rest, and she shows 8 millimeters, which is a lot more than we would want. Lips apart posture, or her lips at rest, are 8 millimeters apart. Long lower facial height is part of vertical maxillary excess, but we just showed that she has a short lower face, so vertical maxillary excess is crossed off as one of our diagnoses. How do clinical findings lead to the treatment plan? Well, we just determined by our clinical examination that vertical maxillary excess is not the cause of her gummy smile. We have measured a short philtrum, so it is a part of it. Excessive smile curtain, which we have not discussed yet, is crossed off the list, and upright incisors, we've demonstrated in the profile pictures, remain on our list of problems, and short crown height, 8 millimeter crown height. She should be 9.5 to 10 by now, so short crown height stays on our list, and there is our treatment plan led to by our clinical findings. Data we had shown in earlier webcasts, philtrum height, male and female, as in all the data, males tend to grow more, they're bigger, but you can see that the trend over time is for that philtrum to get longer. When we compare philtrum to commissure height, they actually converge. In other words, the philtrum lengthens at a greater rate than does the commissure, and this is something which works to our advantage in some cases, but actually disadvantage in others because that is an aging characteristic. So treatment of the gummy smile. What can we do with a short philtrum? Well, that's the burning question. The data we just showed you is an important part of that. What about the upright maxillary incisors? What we do is the mechanics we use orthodontically is very important because there are two ways to upright incisors. One is to use a rectangular wire in our rectangular slot and produce what we call torque, which is where the bracket rotates the tooth around the center of the tooth like that, and it torques the root so there's very little vertical change. That's good for the smile arc, but not great for the incisor display and gumminess of her smile. We might mechanically choose to upright the incisors in a round wire. Imagine that in a rectangular slot, and if we allow that to unravel, it rotates and tips around the the apical tip, and that can produce some mild vertical change. Towards the end of treatment in Tiffany's case, then we are finishing up treatment, and we measure that her teeth are about 8.5 millimeters wide and they're 8.5 millimeters tall. So they're not much longer, and the height-width ratio should be about 80% width to 100% height. So what this means is that it's time for crown lengthening. Part of our diagnosis, short philtrum, upright incisors, short teeth. So we send her to the periodontist for some crown lengthening, which is demonstrated here. And this is Tiffany after we have completed orthodontic treatment. That is her resting relationship. You see the change in the resting lip morphology has been very favorable to us. Her smile, 11.5 in the left picture, 14 on the right. Close-up smile, beautiful smile. Let's watch what happens from 11.5 till about actually age 15. Time-lapse photography of all the things that went on for her over time, producing this beautiful smile. Looking at what happened intraorally, we're orthodontically fixing her bite, uprighting the incisors, opening the bite. Periodontist lengthens the crowns, and we finish getting the bite corrected. Where we end up then is this smile. Here she is at 18, going off for college. And the point is what we said at the beginning. This is a better quality of life, which we feel is part of our role as your orthodontist.